It doesn't matter if you delivered your baby vaginally via C-section in 3 hours in a 3-day labor induction. Your body will need time to heal from giving birth. Hey, what's up everybody? I am Dr. Ali, I'm an OBGYN, and today we're gonna be talking about postpartum pain. Now, I already have a previous video where I talk about the 4th trimester or the postpartum period. So if you want more information on that, I will leave a link down below. First up, I wanna go over some of the symptoms that you may experience that kind of correlate with postpartum pain. And then we're gonna talk about what you can do about this postpartum pain and recovery. All right, let's get to it. So here are a list of some postpartum symptoms that you may experience. Vaginal bleeding, cramping, especially if you're breastfeeding, pain in your back, pain in your neck, pain in your joints and your hips, pain in your perineum, especially if you had a tear during the delivery, pain inside of the vagina and also on your anus. Hello, hemorrhoids. If you had a C-section, you might have pain over the incision. Your belly might feel a little bit swollen. You might have painful breasts. You might have bladder issues or maybe even some bowel issues where you're losing some stool. So how long do these postpartum pains and symptoms last? Now, this is obviously going to vary patient to patient because everyone's healing and everyone's whole process is a little bit different, but overall, a lot of these symptoms do actually go away in a couple of days, sometimes in a couple of weeks. So what can you do about these pains? Now, I'm going to go down a list and specifically go over certain ones, but for the most part, keep in mind, have an open conversation with your doctor and keep that communication going. A lot of the times they may recommend some over-the-counter medications, but also you might need prescription medications. Before I discharge my patients from the hospital after a delivery, whether it was vaginal or a C-section, I like to go over just generalized expectations and then when they should call us or when they should go to the ER. So let's dive in a little bit deeper. Now, we do expect you that after delivery to have some sort of pain that's normal and expected. But when should you really start to worry? The recovery process in the postpartum period, you should still be able to care for yourself and that baby, although yes, it is very challenging. Here's a list of things that you really should call 911 or go straight to an ER if you start having these symptoms. If you're having any chest pain, any difficulty breathing where you're literally gasping for air, that is not normal. If you're having seizures, if you're having thoughts of harming yourself or your baby, if you're having severe pain in your abdomen that's not going away with just taking Tylenol or ibuprofen, if you're experiencing pain and swelling in your legs, definitely call your OBGYN. If you start to develop a fever that's not going away with Tylenol, if you're experiencing vaginal discharge that kind of has a foul odor to it, if you're experiencing heavy bleeding, meaning that every 30 minutes you're running into a bathroom, we need you to get care at that point. If you start having symptoms of a UTI, like burning with urination or anything like that, definitely always call your doctor because we're here to help. All right, now I'm gonna go through specific pains and what you can do at home to kind of help in your recovery. Breastfeeding pain. Now, if you decided to breastfeed your baby, or maybe you've breastfed in the past, you know that this is going to be one of the most difficult things women do. Along with the fact that it's something new that you're learning to do, your baby is also learning to do it because it's new to them. So always remember to show yourself grace. During this process, whether you're breastfeeding or not, you may start to notice that your breasts are starting to get swollen or what we call engorged. That means they're filling up with milk to the point where they can be very hard and very, very painful. So things you could do to help with this is actually breastfeeding more frequently, or maybe even breast pumping. This can help ease the pain and the pressure. Also, using a cold pack can actually help relieve some of that pain. As far as medications, usually the first line for this is using ibuprofen or Tylenol. With Tylenol and ibuprofen, very little is actually expressed in breast milk, so it's actually safe to do while you're actively breastfeeding your baby. Now, you really want to be careful in getting medications from other people or starting to combine different types of medications because you really want to know how much is being expressed in the breast milk. You don't want to put your baby into danger or anything like that. Whenever in doubt, please call your doctor. If you're not wanting to breastfeed, wearing tight-fitting bras and clothing can actually help slow down the production of milk, but also, strangely enough, cabbage leaves can actually help. Another thing to keep in mind is get yourself a lactation consultant. Ask if your hospital provides a lactation consultant. I know that we do, and a lot of our patients get a lot of benefit by having a lactation consultant come to see them and talk them through tips and tricks and all that good stuff before they even go home from the hospital. Let's talk about the back, neck, hip, joint pain. This is all usually due to labor. Obviously, when we're in labor, we're in different positions. If you got in the epidural, you may be on your back or maybe on your side. Maybe you were on hands and knees. Anyway, there's a lot of different positions that you may experience during labor, and this can then contribute to achy and hurting joints in the days after the delivery. Labor is truly labor. It's an intense workout routine. So you are expected to feel very tired and very sore after the whole process. You may also start to feel weak abdominal muscles. Obviously, our abdominal muscles do stretch because of the growing uterus and baby. So immediately in the postpartum period, you may start to feel more weakness in your core. Now, wherever you're starting to feel those aches and pain, definitely try doing a heating pad over these areas. If you are breastfeeding, you don't want to make these worse. So make sure you're finding out what breastfeeding positions are going to be most beneficial for you, making sure you always have some sort of support so that you're not contributing even more to being more sore and achy. Another thing you can definitely do is taking over-the-counter medications, but always make sure you ask your doctor. Pain in your perineum. Now, it is extremely common to have vaginal tears during a delivery. If you haven't seen my video on it, I will leave it linked down below. But what can you do to help with the recovery? Because your perineum and your vagina are going to be sore. Ice packs are going to be very beneficial, especially in the first 72 hours, and in your hospital, they should already be giving you ice packs to help with the swelling and the healing. At home, you can do ice packs on and off for about 10 to 20 minutes at a time. Witch hazel is going to be amazing for your perineal area. I tell all of my patients to buy some of this prior to the delivery so you have it at home and you're prepared. Sometimes using a pillow or a cushion while you're sitting on your bottom is actually going to help with the pain and the recovery. Another thing that you can do is sitz baths. You can buy them at the store where they sell almost like a potty hat or a basin where you can fill it with the sitz baths and some warm water to help with the discomfort and the pain. Make sure you get yourself a peri bottle. If you haven't seen it, it's one of those little water bottle looking things with a little squirt, you know what I mean? You're just like, this is going to help with the cleaning process. Make sure you fill it with warm water and you use this to clean your perineum. Don't ever forcefully dry or scratch. You always want to gently pat dry that area. You can also pick up some Dermaplast. It's numbing spray that we frequently give to women after delivery because we all know you're expected to be sore. Last but not least, if you're breastfeeding, sometimes breastfeeding on your side to get some of that pressure off of your bottom is very helpful as well. Incision pain. If you had a C-section, you know that you're expected to have pain over the incision. Make sure you're taking the prescription strength medication that your doctor gave you. Also, using a heat pack over the incision can be helpful, but I think one of the most beneficial things is an abdominal binder. Now again, ask if your hospital have these available to you because I know that our institution does, but an abdominal binder just helps kind of keep everything tight and together, and it truly does help with the healing and your recovery, and you just feel better. So get yourself an abdominal binder. You could also use an abdominal binder even if you didn't have a C-section. It just helps because after delivery, your skin, your muscles, everything's a little bit more distended. So kind of keeping it tight and close together feels better. Pain with urination. Especially after a vaginal delivery, you may feel the urge where you need to pee and then you go sit on the toilet and not very much comes out. A lot of the times this is contributed to the swollen tissue and not so much an infection, but make sure you ask your doctor. A lot of the times what can help with this is when you're sitting on the toilet, get that peri bottle with warm water and actually spray that warm water over the area, and that might actually stimulate some of the urination to come down. Another old hack that may work is running the tap and hearing that water may actually stimulate some of that urine to come out. Again, a sitz bath is going to be really good to help with any swelling here as well. Constipation and hemorrhoids. I want to start off by saying that being constipated and having hemorrhoids are just one of the very lovely common things that we see in pregnancy all the time. So throughout your pregnancy and even immediately postpartum, make sure you're drinking lots of water, eating lots of fiber, start taking a stool softener, and surprisingly, even going on short walks after the delivery will help stimulate some regular bowel movements. Now, if you do have some hemorrhoids, because I understand that sometimes they can get pretty bad during pregnancy, try doing some of the over-the-counter medications for hemorrhoids, but some women may actually need something that's prescription strength. So if you're having severe pain or just pain that's uncomfortable to you because of hemorrhoids, reach out to your doctor. We know how we can help. Keep in mind that sitz baths here is also gonna help, witch hazel will help, and just those over-the-counter topical ointments typically help as well. One of the biggest things to remember that if you are constipated or have hemorrhoids, Do not strain. Don't just sit on your toilet and strain and push really hard. That's going to make things worse. If you sit down because you have that urge to have a bowel movement, but then you find yourself really straining, I want you to get up, drink some water, maybe go on a short walk, something. The more that you sit there and strain, it's actually going to make it worse. All right, I think that covers everything as far as postpartum pain. If you are currently in the thick of it and recovering from your postpartum period, keep in mind that this is just a postpartum period. It is the season of your life. It is okay to ask for help. Please use your OBGYN and the resources. We are here to help answer your questions. I don't ever want you to feel like you're alone in this and that you can't reach out and talk to someone. I hope you guys found this video helpful and gave you some good tips and tricks. Or maybe you're pregnant and you don't really know what to expect. I hope you check out the other postpartum video that I made to give you even more information about healing and recovery from pregnancy. I'm gonna link that postpartum video here on the screen so you can click on it and go watch it right now. All right, you guys, I hope you learned something new today and I hope you enjoyed this video. I love you guys so much. Always remember to be kind and show love to everyone around you. I will see you in the next video. Bye.